Hi everyone, my name is Dominique Karna and I am in the MSN program at NUR. I'm in Nursing 673, and for our health assessment video projects, we were assigned to do a peer review. I'll be peer reviewing Wendy's YouTube video, which was a depression comprehensive assessment. So I'll just be going over a peer review for that. Wendy, first of all, you did a really nice job on your video. I really enjoyed watching it, and I felt like I learned a lot about doing a little bit more of an in-depth focused depression assessment. So I thought you did a really nice job with it, so good job to you. Some of the things I really liked about your assessment video that I thought you did really well were you were very clear, concise, you went nice and slow, so I thought your presentation and your assessment and conversation skills with the patient were really good. I know sometimes obviously doing a depression screening can be difficult. You have to ask tough questions, it can be a little bit uncomfortable for maybe yourself and the patient. So I thought you provided a very nice non-judgmental environment for the patient. I thought your responses were very empathetic, understanding. You did a really good job of asking follow-up questions and kind of bridging off of, risk factors and symptoms of depression the patient was presenting with that you found from your assessment questions. So I thought you did a really nice job overall with the exam and the assessment. One of the things I do wish that maybe you did mention in the video was after, the questions and the assessment was completed, you did talk about, how the patient was presenting with the depression symptoms from, the assessment questions you asked. So that was very helpful, but I do wish that maybe you talked about what normal findings on that assessment would have looked like as well, just because I know we were supposed to review abnormal and normal, so I do think that would have been helpful. One of the other things I was wondering, I liked how you talked about depression risk factors for the patient and how the patient did have some of them, and precipitating factor is a job loss, so I thought that was really helpful. But I'm not sure maybe if the fact that the patient is young and male, sometimes those patients do get depressed more frequently or do have higher risk of self-harm, suicide, especially more in a violent manner. So I thought maybe you could have talked about that as a risk factor a little bit more, but I do really like that you touched on the depression risk factor, so I thought that was really beneficial. You did ask him about substance use, which was really good, but I didn't really hear you ask about alcohol use, and I was hoping that maybe in the exam you could have covered all the substances, alcohol use, drug use, tobacco use, vapes are really popular now, and just asked about, if the things that were precipitating his depression risk factors, such as a job loss, also caused him to have increased use of those substances, because things like that can, further worsen depression and safety risk factors and stuff if a patient is feeling this way. So I was just wondering if maybe that was something that could have been further looked into a little bit. I know as far as you asking about depression and self-harm, I thought that was really important to touch on, so that was good. But I just know having prior history of those attempts, such as self-harm or suicide attempts, does increase a patient's risk factor going forward for, reattempting those sort of things. So I was just thinking maybe that would have been a good thing to include in the assessment as well. And then a big thing for me too was I didn't really hear you ask too much about, do you feel like your home is safe? Are there any weapons, accessibility to those weapons, etc. in the home? When we do know that patients are coming in and they are showing signs and symptoms of depression and things like that, I think it really is important to assess how safe their home is and access to things such as guns and whatnot. Are those guns locked up? Because especially males are more likely to take violent means of self-harm, suicide attempts, etc. So I think those would be really big risk factors and things to assess in the household. And I really liked how at the end you talked about medications, resources for people with depression. I really liked how you talked about the suicide hotline, because that is a really important tool for people struggling with depression and mental health. The only thing I wish you included maybe just would have been the suicide hotline number itself, and maybe just touching upon the importance of when you're going for these annual physicals. You know, they are having you fill out a depression risk factor questionnaire, and I think, you know, again, this is one of those reasons it's so important to attend yearly physicals and have your primary care be very involved in that, because that is like the most basic way to kind of on a regular basis be keeping track of that. So I think even just talking about the importance of depression screening, you know, in our basic primary preventative care would have been good too. But overall, you did a really nice job. Your presentation skills were great. I thought, you know, your video was really helpful in helping me to learn a little bit more about a depression health assessment. So really nice job, and congrats on finishing the semester, and I wish you the best. So thank you very much.